Good afternoon, everyone. So I hope you enjoyed the video of IIHMR Bangalore campus, the campus tour, virtual campus tour actually. So I hope I'm audible. Can you please once confirm that? Yes, I'm audible. Yes, I'm asking the students.
Yes, sir, you're audible.
Okay, so welcome to the today's sessions, which is actually related to the harnessing the growth and vision in healthcare in 2030 mainly. So I'll be discussing about our college, I'll be discussing about our institution. Also, I'll be discussing about the career opportunities, what you can have, and also what are the specializations we are offering here in IIHMR Bangalore, and what is our legacy behind like training the students from last 14, 15 years and the 100% placement record what we are having till now, and the proud alumni also we have all over the world and associated with us till now, and they are also having some testimonials which is can be shared. So this is the thing, like we as a family we have grown all together and we have trained a lot of students. So in that case, and with that I'll be sharing my slide, just some half an hour to 40 minutes of presentation is there. Then after that we can have the question answer sessions, means you'll be having some queries, so you can ask me, and even if you want you can actually stop me anytime and you can ask me your questions. Okay, so I hope my screen is visible.
Yes, it is visual.
Okay, so that is how it is, and I'll be starting my presentation with a famous quote. And this is my profile. This is my profile. I'm a PhD scholar also, and I'm working as an assistant professor in IIHMR Bangalore. And I'm a certified good clinical practitioner and good pharmacy practitioner from professionals of Faculty of Pharmaceutical Medicine, Royal College of Physicians, UK. And before this, I was into healthcare industry in pharma, and I was a person actually involved in the Covishield vaccine launch with AstraZeneca. And before that, I was with Glenmark as a product manager. And I have almost like 12, 13 or 14 years of healthcare or pharma industry experience. So that experience actually I'm imbibing into the, when I'm designing the curriculum for the students. And that is how we'll be discussing that thing, like what is the edge, what is the difference between all the other institutions and IIHMR Bangalore. Okay, so that is what, as I said, like I'll be starting with famous quote from Benjamin Franklin, who was one of the like America's most sought after writer, if I say, then activist and also scientist, inventor, statesman, and also diplomat. So he told, like, tell me and I forget, teach me and I remember, involve me and I will learn. So that is how it is. Like here, the curriculum, what we are designed and what we are providing to the students, it is all under the industry orientations and industry oriented curriculum. So what actually you'll be doing in the industry, like there is no such gap right now. And previously there was huge gap, like what there was a theory and the what the applications part, there is a huge gap, like a lot of students are facing, used to face earlier. But right now we are bridging that gap. So that is how it is. IIHMR Bangalore is one of the institution which is providing the hands-on trainings like observership and also internship and even like dissertation programs along with the institutions and mentors from the institutions. So that is how they're getting hands-on for all the projects, all the applicability of the theory part. So that is what actually I wanted to acquaint all of you with. So if I take you through the background of the healthcare industry in India, so right now it is growing almost at 16.28%. And if you see like from since 2008, right now in 2022 and 2023, it has become almost 400 or 450 billion dollar industry. And there is a requirement of 7.5 million people by 2025. That means it's huge. The prospects are huge. So it's not only into only one part of or only one aspect of healthcare. There is like multi-oriented healthcare aspects is already there, which is waiting for all of you. There is huge prospect mainly related to the industries such as hospital, diagnostics, then also health insurance, health home healthcare. Because if you ask me like why this concept of home healthcare happened, like there is a kind of like we are facing the situations where all these old aged people, they are being abandoned by their like children, and they are staying there in the like old age homes and all. So who will be taking care of them? Okay, it's a concept of US only, but it is already there in India. So that is how the entire healthcare industry being changing. So that is how the entire paradigm shift, if you ask me, that is happening. So that is also related to this home healthcare, then health IT. Like if you have heard about IoT, IOMT, then also technologies such as maybe artificial intelligence, okay, remote patient monitoring, all these things happening because of this industry shift. Okay, and even medical devices, like India has become one of the topmost hub for manufacturing and marketing these medical devices all over the world. Okay, be it like smartwatches, be it any kind of sensors. Okay, so I'll be telling you one example. Medtronic and Samsung. Samsung we know for the company like who are manufacturing mobile phones, smartphones and all. Medtronic is the company who is manufacturing the insulin pumps. Both of them come together to manufacture artificial intelligence based sensors which will be detecting the hypoglycemic event for the patients who are in type 1 diabetics, because as we know, like type 1 diabetics, they don't have beta cells of islets of Langerhans, so there is no insulin from the body. Okay, so but they are having food that glucose actually coming and shooting the glucose level in the blood, how to actually break down that glucose and how to like mobilize glucose in all over the part of the body. There is requirement of insulin, and those kind of people are taking insulin injections. So they are detecting that number of hypoglycemic event, and they are detecting how much bolus amount of insulin is required, and also how much amount of food is required for those kind of patients. Okay, so that is the paradigm shift already happened in India, and it is happening in Bangalore only, like Samsung R&D Center in Whitefield. Okay, they are doing all these researches over there. Then health IT, of course, like as I said, one of the example like IoT, IOMT, IOHT, like data transfers, and there is also like brief draft already been there in Indian government. Okay, all these things are happening. Then assisted living centers, as I said, the entire industry is moving in the paradigm shift of, like as I said, all old age patients, geriatric patients, they're being started staying in the old age homes. Okay, so what kind of technologies will be provided to them to helping them to thrive into those kind of environment? That is why the entire industry is moving. Then if you ask me like what is the healthcare demand for next 20 years, so there is a requirement of 3 million doctors, 3.5 million beds, and 6 million nurses. Okay, because the thing is, most of the time the entire scenario or ecosystem of the healthcare in India being covered right now, it's almost 50% is covered, but coming days there will be 80 to 90% coverage will be there in the blanket coverage of the insurance, like IIHMR Bharat, like ABDM, all this like digital health parameters and all. So in that case, there is a requirement of demand of managing the entire ecosystem. Who will be managing? You are the people actually. So that is the entire thing here, what is happening, and that is the boom, what is happening due to all this Ayushman Bharat Digital Health Mission, or if you ask me like ABHA kind of applications, what is actually already been there. Okay, but if you ask me like what is the use of ABHA, if you have heard, ABHA is having that application where you can register, anyone can register as a care provider, as a kind of like maybe as a dentist, as a doctor, as even like kind of as a patient, also as a hospital, whatever is there. Okay, so this kind of registration is there so that the registry of the amount of data being already captured, then those kind of data will be useful for those patients, and they'll be doing kind of analytics part, and then after that they're giving a trend analysis, with the use of machine learning and artificial intelligence that can be useful for future predictions, maybe in public health, maybe in pharmaceuticals, maybe in hospitals industry, maybe in health IT industry. All these things are possible. Okay, so that is how the things are. So here, if you ask me the background of our institution, so our legacy started in 1984. And that time, mainly IHMR was specialized in research, postgraduate education, and training organization in the health sector. And we have our main campus in Jaipur, and it is 65th in the prestigious NIR of India 2020 ranking. And it is coming in top 1% of management institutions in the country. And also legacy in healthcare with 35 plus years in presence in the healthcare, recognized also as Institute of Excellence by Ministry of Health and Family Welfare. And it's once again like kind of a added advantage, or if you ask me like added crown to our jewel is like WHO collaborating center. Okay, and not only that, there is also public health school already been started, Okay, so this is the IIHMR University Jaipur, and there are another two campuses, and one is here in Bangalore, another one is in Delhi. So what about the Bangalore campus? So IIHMR was granted university status in 2013. In 2014, IIHMR Bangalore received NABET accreditation as consultancy organization for NABH. 2017, we have introduced health informatics technology domain. And in 2018, IIHMR Bangalore is recognized by AIU. So as we are saying, like you people doing PGDM, whether this PGDM is postgraduate level course or maybe only diploma, this kind of query are already there in your mind. So I'll be telling you like it's actually approved by AIU, which is Association of Indian Universities. What it is exactly, what is the approval? The approval is, it has been regarded as the postgraduate and it is almost equivalent to MBA and master's degree. So what does it mean? After concluding this degree, like PGDM in health and hospital management, you can have any other further studies. You can have placements in out of country, okay, anything as such. So that is how it is. So, and AIU has been regarded in all over the world. Okay, so that is how the things are. And even it's been expanded in 2020, like educational programs offering with 120 seats along with pharmaceutical management. So I can say like I came that time and actually I started that pharmaceutical management curriculum and I designed that curriculum with my experience of pharma industry as well as the theory part, because basically I'm a pharmacist. Then after that, I've worked in the healthcare sector from last 12, 13 years. So that is how the things are. Even not only me, other faculties are also same. They're also having a quite like 15, minimum 15 years of experience in industry. Then after that, they came into academics and still they are doing consulting projects with the industry. So that is the difference here with other institutions. That is how students are knowing what exactly is happening in the industry. Okay, so that is how the things are. Then what are the like parameters what in which we are actually having like mainly key verticals? So one is academics. As I said, like there are 4 specializations like hospital management, health IT management, and pharma management. So total seats are 120. And as I said, like we are being boast of like excellent placement record, almost 100% since our inception. Then types of project like implementation research, social assessment, thrust areas, RMNCH, life science, health NCD, health communications, digital health part, geographics, rural, tribal, and urban India mainly. And we also have training verticals like management development programs, faculty development programs, okay, executive development programs, certificate programs, short certifications like 3 to 10 days, maybe like students engagement programs, webinars like how what we are conducting right now, giving you actually some awareness of the industry. Then equipped for in-person, virtual, and hybrid programs also. And of course, consultancy. As I said, all of our faculties, including me, also part of consultancy projects. Okay. So even institutional consultancy, like we are being part of NFHS, NHSRC. Okay. So all these things, like we being a part of a research organizations, we are actually spread everywhere. Okay. So healthcare, IHMR. Without IHMR, healthcare is not complete. It is incomplete always. Okay. So that is how the things are. So that's why the curriculum what we have designed been followed by IIMs, being followed by ISBs, and also even symbiosis. Okay. So that is how they have started their own programs, and that programs are even like online. Okay. So online programs can give you degree. Okay. But they cannot give you hands-on. What we are giving, what IHMR Bangalore is giving, so that is how the things are. So that's why the curriculum is designed in such a way. So in the first year, you'll be having observership of 15 days where you'll be seeing and you'll be like observing the things, how it is happening. So it is actually giving you the glimpse of industry. Okay. So first year, you'll be learning each and everything, each and every aspects of healthcare, health technology assessments, health economics, marketing, everything. Okay. Then second year, you have to choose the specialization. So before coming into second year, you'll be knowing about what is happening in and around of the industry. Then after that, you are choosing your specialization in the second year. So during that specialization, when it has been started, maybe after a few modules, you will be going once again, going back to the industry and will be doing 2 months of internships. That is known as summer training program or STP. By that way, we'll be doing some projects, which is maybe life projects, which is maybe like kind of a product launch kind of thing, maybe designing something. Okay. So by that way, once again, as I said, observership, you have observed something. Then right now, that observation and theory, both combined, you'll be actually applying for providing something, maybe some solutions for healthcare problems, By that way, during STP, you are designing something, maybe healthcare programs, maybe applications, anything in hospital, health IT, pharma, or anything. That is how it is. So I have launched some project. Once again, coming back to the theory part and completing the modules. Then as soon as you have completed the modules, then you will be having dissertation programs, which is the end of the entire program. By this entire process, you'll be already absorbed by some of the organization. Okay. So that organization where you are already part of maybe observership or maybe summer training programs, they have liked your product. They'll be actually absorbing you for as a trainee or maybe as a permanent position. That is how placement happens. Okay. So it is not like a kind of a game of overnight, like a company comes, they'll be taking up and they'll be taking up interview. Those things are already there, but the things are like what you have learned. It will be not like kind of a huge gap of the application part. Okay, nobody can think that, yes, I have learned something in book, I have learned a theory, but how I can imply that theory with the power of application and design a product, maybe, or launching a product in digital health, or maybe solving a problem of health and hospital institutions. So those things are already there in the curriculum. It's a process. Always you'll be knowing that, yes, if I'm getting hands-on, it's a process for me, how I'm learning, then after that, how I'm applying that. That is how everything happens. Okay. So that is how the things are. Like, these are the research projects what we did already, like implementation research, as I said, mixed method research, large scale surveys like NFHS. Okay, social assessment. Okay, formative and impact assessment. Then I see social behavior change communications, mainly for tobacco and all these usages for the children, for the school. Then urban and tribal health, maternal and child health, nutrition and health, health system strengthening, etc. And these are the training, glimpse of the training program. There are long-term management, student focused, and even like certification, like short-term executive and webinar series are already we are conducting through maybe like Zoom or maybe MS Teams, whatever is required, whatever the platform you want. Accordingly, we can design that programs. So some of the glimpse of these kind of programs, be it in certificate course in integrated digital intensive care management, nutrition and health, okay, then also quality assurance and accreditation in healthcare, then executive program in hospital management, and also our training partners. If you ask me, big people are already there engaged with us in terms of providing this kind of academic orientation, such as RHDX hospitals, Sanitas Hospital, okay, from Africa, then Burjil Hospital from Abu Dhabi, okay, Cloud Physicians, then VGU as academic partner for the university, then University of Mysore, then Maastricht University, Netherlands, HX Central. Okay, these are the companies and universities and organizations who are already part and partnering us, providing the curriculum, providing the advancement of training programs, everything. Okay. So as I said, like there are 4 specializations. And if you ask me about the accreditation, these part are already there. And these are the awards and accolades along with the accreditation. So impeccable success, what we are already being achieved. And if I say like I'm boast of, and actually we are proud of our students also, because students are fetching their achievements, students are gaining that momentum and reaching out to that level. By that way, they're making us proud. So that is how the things are. So if you'll be joining us, you will be having that achievement. By that way, we are feeling proud of it. That is how the things are. And you have to be knowing all these things, because before joining any organization, before joining any institution, you should know like how institutions are offering and what are the offerings from the institutions in terms of learnings also. What are the offerings from in terms of curriculum also. By that way, how I can change my life, how I can actually making changes in the society and making changes in the healthcare institutions, or maybe healthcare problems, maybe like providing some solutions of healthcare issues in India. So India's top most B schools by Outlook in 2021, our rank was 10th. Right now it has jumped further, okay, 3 ranks, and right now it is 7th, okay, in 2022-23. So that is the achievement by students like you only, okay, and it was ranked 19th by Academic Insights in 2021, and right now 11th by the famous magazine. So these are the awards and all. Our director and our dean academics, both of were there in like outstanding academic institutions award in Times Ascent. And key achievements till now, like we have conducted almost 1,000 plus industry-based training programs for executives and students, and then 800 plus health research projects, and then 100% placement records, of course, we already have, and 80 plus regular recruiters. And I'll be discussing that in my coming slides also. 4,000 plus alumni base across globe. So I'll be telling you one more thing, like If you ask any of the hospitals anywhere in big cities, Bangalore, maybe Delhi, maybe Chennai, or anywhere, okay, like Apollo, like NH, or maybe like Fortis, or maybe Medanta, maybe Care, there will be some students, one or two students will be from IIHMR. So that is how the things are. No hospital is left where IIHMR students are not working, be it in high positions, be it in director, be it in like housekeeping head, or maybe like kind of a quality head, or maybe like kind of NABH associates, whatever. Okay, so they are already there in that position. And not only in India, they're also there in out of India and countries such as US, UK, and then Africa, then North, Southeast Asia, Latin America, Canada, everywhere. Okay, so that is the things are, and these are the accreditation and empowerment, empanelment, like AICTE. They have accredited us because it's already the technical education, and it is NBA accredited also, like National Board of Accreditation, and AIU, and then registered with NIRF, National Institution Ranking Framework, and empanelment such as Har Ghar Jal Jeevan Mission, like in Karnataka, it is known as Har Ghar Gange. So we are the organizations who are actually providing the maybe like underprivileged people, or maybe the people who are not having the boring capacity for going deeper and like digging deeper and finding out water. So we are actually helping them out from the government perspective. Then NHSRC, implementation research for health system strengthening. Then M&E project. Okay, so it is under Karnataka Evaluation Authority. National Health Authority in nature projects, NABET, like it is the accredited institutions as a consultancy organization for NABH by the NABET, in the National Accreditation Board of Education and Training, and Quality Council of India. So that is how the things are. So that means I'm just emphasizing once again the last part. We are the organizations who actually can accredit any of the hospitals. Maybe they can assess, then after that, they can give certifications, particularly for accreditation part of any of the hospitals, which is open newly. So that is the thing. So that is the importance of the organizations such as IIHMR Bangalore. Then it comes collaboration and tie-ups. I have given a few glimpses in my previous slides, and right now, once again, more emphasizing on that. Like we have empanelment and accreditations University from Netherlands, then Vivekananda Global University, Jaipur, then BNM Institute of Technology, New Delhi, Mahidol University, Southeast Asia, and then like University of Mysore, then healthcare technology such as Renalix, HX Central, RxDX Hospitals, Cloud Physicians, Bionic Yantra, healthcare delivery such as Burjil Hospital, Abu Dhabi, Sanitas Hospital, Rajarashwari Medical College and Hospital, Sakra World Hospital, Narayana Health. So to name a few, this is just the few names what you can see in one maybe one screen. But there are a lot of other hospitals and other institutions who are very big already there, who have taken a lot of students. Okay, and we are actually proud for them also, for those students also. So if you ask me what are the international organizations or international bodies or agencies, apex bodies who are being tying up with us, WHO, of course, as I said, WHO, and even not only UNICEF, there is Bill and Melinda Gates Foundation, okay, ICMR, okay, then Karnataka Examination Authority, NRHM, then NGOs and trust organizations such as United Way, then the Incline Trust International, HCL Foundation, okay, Bhoruka Charitable Trust, HLL Life Care, Akshay Patra, Piramal Swastha, okay, then private healthcare organizations such as Novo Nordisk, JSW, Sakra World Hospital, JSS Hospital, Mysore, Premier Hospital, to name a few once again. Like these are only coming in all together in one screen. That's all. But there are maybe more, means double or triple than that, who have already taken our students, and they are our proud alumni, and they are also providing a lot of performances for those. Have already happened, and for this year also, just few students are already there who are actually means they are getting into all these organizations, but to that, like 80 to 90% of students already been placed. Just few students are remaining, so they are actually appearing for the interviews, and they are looking for actually the jobs which is maybe like kind of a dream job for them also. So that is how the things are. Like it is actually providing them that platform where they can, the sky is limit for them. Actually, they can achieve whatever they want. They can achieve the stars over there. Okay, so that is how the things are. So highest package you can see like in the screen, it is 24 lakhs per annum and median salary is 6.5 lakhs per annum. So that is how the things are, and it's already documented, it's already there. And there is also international placement opportunities for everyone. So whoever wants to go. So that is how the things are. Companies such as Deloitte for consulting, Byju's, Kakinos, Axio, Apollo, ZS, Tech Mahindra, Primera, okay, Narayana Health, then Cerner, HX Central, Tata MD, PwC. Okay, and not only that, other recruiters. So that is what, like, it is maybe like these many number of people are actually, or even the organizations only fit into this screen. But there are maybe 10 times or 15 times more organizations which are actually coming in the for campus placement or maybe just recruiting people. So like, as I said, most of the organizations already know, I have already discussed. To name a few, like Fortis, I have told, Practo, okay, then Accenture, Hydoc, Allscripts, Cognizant, okay, then Manipal, then Biocon, Cerner, okay, Teleradiology, okay. So all these organizations, they are, once they have actually get convinced with the students, and when they are seeing that your students are performing well, then they are once again coming and taking the students from IIHMR Bangalore itself. So that is how the things are. That is how they have created their name. They have created their, when you are being selected and then after that you are performing good in the organizations, you are achieving something, you are creating your name along with our name also being associated. So that is how the things are. Okay, that is how you are making yourself, your parents, and us also proud. So that is how the things are. So this is the platform, and this is the like system where we are making the students achieve something. So that is IIHMR Bangalore is actually being regarded of. Then these are the snapshot of 2021 23 batch. Like they are being placed in big organizations such as Phoenix, Primera, then AIOCD, Deloitte US, and then even pharma companies such as AIOCD, etc. Then endorsement from the alumni, like Neha Bish, Dr. Neha Bish, project manager in Stanford Health in USA. Then Ms. Pragya Patnaik, and senior healthcare IT consultant in Deloitte. Then Mr. Pratip Sinha, who is managing director, Tevi Healthcare Center, Malda. So they already being proud of our systems, and also we are being proud of them because they have already achieved something and they are heading the organizations over there. And they are creating their own team, they are recruiting people also. Okay, so that is how the things are happening. And not only that, IIHMR Bangalore also builds career for the students, also creates future healthcare leaders for the world by bringing out best out of them. So last year, 6 out of most promising students secured 100% scholarships for universities such as Arizona State University in US, American University in Washington, DC, Pepperdine Graduate Business School. So for getting some certifications programs from them. So otherwise, it is 100% under 100% scholarship. It was free totally for them. Otherwise, the cost is almost 2 lakhs rupees actually, according to their price. Okay, they are asking for $1,500 to $2,000. Okay, but these kind of students actually being mentored by the faculties like us, and they have fetched this kind of scholarship, this kind of certifications, which helping them internationally, maybe helping them even domestic also, like getting into the projects and getting into the organizations of their dream. And means when you go into the corporate, there are certain certifications requirement are already there. Not only certifications, also applications like what you have learned, maybe like Excel, PowerPoint, okay, then Power BI, then Tableau, okay, SQL, all these things are coming in health IT as well as prospects of health analytics, business analytics part. So they have learned it. Then after that, they have faced kind of interview. So it's been mentored by students, mentors, this kind of mentorship already there from the like professors like us, and as well as even faculties like us, and we actually mentored them. Then after that, they have faced this kind of interviews and they got this job. Okay, so that is how the things are. And also they are last year actually some 3 to 4 research paper already been selected in virtual poster presentation for International Society from this, which is a professional society for health economic and outcome research 2022 in Washington, DC, and it was virtual presentations. So getting into that also very important aspects, because some organizations, they're looking for some researcher, some public health institutions, some public health organizations who are mainly hiring researchers who will be having this kind of profiles of students, they'll be directly taking them up. So that's how the things are. So not only that, our star student, Dr. Thadakuluru Sivasai, I think you have seen him in last video also when I have invited him. So he's already heading one of the organization in Karnataka. Okay, so he is a Karnataka head. Okay, so he actually got Young Researcher Award in 2022. and he was along with his director, our institution director, and that is how the things are. That is how he is making us proud. And if you ask me what about the life, like all, I'm not only talking about the only studies and only everything related to theory or book only. We are also enjoying a lot. This is batch. Okay, we have enjoyed all the festivals. Okay, they have danced and all everything. They have enjoyed each and every festivals, each and every like celebrations. Okay, be it in Foundation Day celebration or be it in like freshers and farewell celebrations. Okay, everything. And then Dashera celebrations also, then Janmashtami, then convocation ceremony, Onam celebrations, okay, and more, whatever means if you once again, like it's kind of a mini India. So there is no state remaining from where the students are not coming. Even like Union territories such as Andaman and Nicobar. Okay, people are coming from those part of India also. So our team, like this is our chairman and also like the trustee and secretary, and like Dr. S.D. Gupta is a fellow from Johns Hopkins University in US. Okay, and Dr. Ashok Agarwal also, and of course our director, Professor Usha Manjunath, and our Dean Research, Dr. Sarla Raju. Okay, then Academic Advisory Council, like chairman, then also our Dean Academics, Dr. Kirti Dwai, and Mr. Ram Milan Shukla, then Dr. Jyoti R. Munawali, and Dr. Chetna also. Okay, so intellectual capital, like this is our intellectual capital of professors and faculties. Okay, and how actually I'm finishing my presentations. Any questions? I'm happy to take. Okay, so any queries, anything? Yes, you are free to ask anything. So I'm happy to answer. Or you can post in the chat box also. Yes, any question. So I have covered almost all the things, but maybe some like queries will be there in your mind. So I'll be telling you like the cost of the course is 7.5 lakhs right now for 2 years. And there are even scholarships also. Okay, so if you have scored more than 60% or maybe like more than 70-80%, so there are certain like benchmarks, particularly for the scholarships. For that, you have to just contact the admission, and you'll be knowing that what are the parameters of that also. And even not only that, there will be also other things like GDPI and other parts. So the thing is, if you have appeared for MAT, CAT, or anything, any maybe like any state level entrance exams for management and all, so you are not actually eligible for any kind of GDPI. You'll be directly getting into admissions. Okay, so we'll be not taking GDPI directly. You will be admitted over here in our institutions. But you have not appeared, then you have to appear for any kind of GDPR what we are conducting. Okay, so that is the thing. And any other questions, anything like the hostel charges are like separate. Okay, if you want to stay nearby, there are hostels. We also have hostels and all. So that is separate. But the course fees is 7.5 lakhs. Yes. Yes. Any questions? Okay, so if you are not like means don't want to ask any questions right now, so I'll be posting my number. Okay, I'll be posting a number in the chat box. Okay, you can message me anytime. This is my WhatsApp number also. Okay, if you want to talk to me, you can talk to me anytime. Okay, so not an issue. And my name is Mrinmoy Roy. I'm working as an assistant professor here. So yeah. So if you have taken down, you can take down, you can message me. This is my WhatsApp number, as well as you can call me. So it's up to your convenience. Okay. Okay, then. So thank you so much for your participations. I hope whatever the doubts coming in your mind, like how the healthcare scenarios are there in India, or maybe how it is working in out of India, and how we can make up our growth maybe in career, or maybe like what is the future aspects, like harnessing the healthcare aspects and Vision 2030. So I hope I have taken up and I have answered some of the unanswered questions were there in your mind. So that is how the things, sir. If you want to know more, once again, as I said, like I have given my number, you can talk to me. Okay, so if you want to understand further, like how these kind of courses will be helping you out. Okay.